Receiving a breast cancer diagnosis comes at a huge shock for many, and the psychological impact can be devastating. However, the financial impact can also come as a huge shock, as well as the impact upon your working life. Breast Cancer Network Australia, or BCNA, conducted a survey of 2,000 people across Australia who have received a breast cancer diagnosis. It asked participants about the out-of-pocket costs of their breast cancer treatment and care and other associated costs. We sat down with BCNA's CEO, Kirsten Pilati, to find out what they found about the financial and employment impact of breast cancer.
We were delighted that so many of our members wanted to participate in our financial report. So over 2,000 women and men who'd been diagnosed with breast cancer reported. Mostly there were some interesting things. 74% of them were have had private health insurance, and so I think that does skew some of the data for us. We know from the survey that 12% had no costs from their breast cancer experience, which is great. But we know that even if people make a choice to go public, that there are out-of-pocket costs. And I think really what the research highlighted was that there's a big range, and there is often a shock value to that range. And so anywhere from 25% of the 2,000 had out-of-pocket costs of more than $21,000, and those who were in private had an average of $17,500 out of pocket.
Do you find people are well informed about the costs of public and private?
I think there's some real issues at the point of referral for patients, and that's certainly what they reported in this report, but also in our landmark State of the Nation report, which had more than 15,000 people participate in it. What we heard was that at the point of being told you had breast cancer, so either through breast screen or your GP, the only question you're asked is, do you have private health insurance? And I think for many people, you think for years you've been paying private health insurance and now you've been diagnosed, that's going to help you be fast-tracked through the system and help with a lot of your anxiety. But actually what people didn't realise was just how many things have out-of-pocket costs and how many things are not covered by your private health insurance. The biggest shock of all being that radiotherapy in breast cancer is not covered by your private health insurer. And I think there's an absolute lack of clarity from clinicians to patients around that.
Did you have a look at the demographics of people submitting their answers? Was there a difference in, age, location, that kind of thing?
We did find there was the biggest area of change was that for rural patients. So we also looked into the impact of work and the loss of hours by household. Where in metro areas, 50% of women who of households actually had a loss of household hours, but if you look at regional areas, 70% had a significant loss of household hours. So that makes a very big financial impact to you. But we also found in rural areas their out-of-pocket costs were the same, but actually they were having less treatment options. So many people were choosing not to have reconstruction, not to have radiotherapy, and really, sadly, not to have some of the follow-up tests that are required just because they simply can't afford it.
But that's obviously got other implications, that you could be diagnosed again further down the track, that kind of thing. Was that an anxiety that you found? 84% of our members, the thing that they report the most that they fear about is that their breast cancer will return or will, if they're a metastatic patient, progress. So it's a very real situation, but when people are forced to, whether they pay their electricity or pay for a scan that month, then electricity is going to win. And this is one of the real fundamental problems of the financial toxicity that we have. And I think many times clinicians really think about the egregious fees that are being charged by some of their colleagues, rather than understanding that the toxicity is actually in breast cancer, the accumulation of costs that just keep coming and that people aren't prepared for. So every time they go to the letterbox after they've had treatment, they're getting another bill that they weren't told about, the bill for pathology or the bill for the assistant anaesthetist. These are all things that are not disclosed currently to patients, and it's that accumulation of the whole treatment cycle which then makes them make different decisions, particularly in that survivorship phase. So we know that they're not accessing allied health services because of the out-of-pocket costs that it involves.
You find people are leaving the workforce or reducing their hours, and also are you finding people weren't reducing their hours because they simply had to have that money?
So 7% of our members in the survey reported that they worked when they did not feel capable of working. The other thing is, I think it's important that people understand the context in Australia. 38% of Australians do not have access to sick leave. And if you are living paycheck to paycheck, of which 10% of us are, and 58% of Australians are reporting, 68% of Australians are reporting that they're in financial stress, then if you layer that with some of the decisions that have to be made, people will have to work through their treatment. And I think for me, I've been at BCNA 13 years, and that's been the very big difference for me. 13 years ago, women were diagnosed, they immediately stopped work and they could afford to. But now families are completely reliant on two incomes, or single women being diagnosed absolutely have to work. And so it's a real barrier for them.
Is there any services people can access for help?
We certainly know that Centrelink does provide some services for people. We do know through State of the Nation that depending on who you call at Centrelink and who answers the phone, you'll have a very different experience. And I think that all of us in the healthcare sector need to play a role in properly referring people to services that do exist. Obviously, the Cancer Council provide fantastic financial support, but it is means driven. And so that for many people who are just on the brink, then that can be really difficult. But I would encourage patients to either call the Cancer Council or call BCNA on 1800 500 258, and they can access what we know services that are around.
Okay, so what needs to be done? What needs to be done to help reduce this impact?
So I think there's quite a few things that we can do together, everyone in the healthcare system. So the first is we do want full transparency of fees, and that is at every element of treatment. And it is no longer okay to say, well, actually, we don't know what's going to happen to the patient, so therefore we can't give them an accurate quote. We must ensure that women and men who are diagnosed are not having a shock from any bills that they're getting. We definitely need to work on the patient-assisted travel scheme and making sure that rural patients are fully compensated for the travel that they need to get to ensure they're going to the best treatment options, not to be being treated by generalists, but they're actually going to MDT teams and breast surgeons in particular. And I think if we can all work together on finding that transparency, it will be really important. And I think radiotherapy, we've got a long way to go in the way that radiotherapy is delivered and the corporatisation. It means we have to deal with that in a policy setting that is different to what we're talking with around government policies of full financial disclosure in the surgery or oncology areas. So there's some work we need to do there. I'm just so thrilled that really the leaders in the area of breast cancer are helping to shape policy for all cancers, and that is because we're showing a really good way of consumers working with the health providers to get a better outcome for patients. And if we can lead the way and then help other cancers to understand that, then I think it's really, really important, and we should all be proud of what we do in that space.
That was Breast Cancer Network Australia's CEO, Kirsten Pilati. If you'd like to learn more about breast cancer trials or you'd like to support our life-saving research, follow us on social media or visit our website at www.breastcancertrials.org.au.